Hi, my name is Jeffrey Dick. I'm an orthopedic surgeon with Twin Cities Orthopedics. I specialize in disorders of the neck and back. Low back pain is the number 2 reason that people go to the doctor in the United States. I'm going to give you some tips today that can help to prevent low back pain, and if you already have it, these tips can help to improve it. These tips aren't exclusive to the low back. They can help other musculoskeletal conditions as well. Keep a healthy weight. More than half of the people in the United States are more than 30 pounds overweight. The mechanics of the spine tell us that the pressure in a disc is actually 3 times your body weight, so that 30 pounds actually translates into 90 pounds of extra pressure on the disc. This is true of other parts of the body as well. The mechanics of the hip joint tell us that there's actually 4 or 5 times body weight on the hip when you take a step. So that translates to 150 extra pounds on the hip joint. A couple of years ago, I had a patient in clinic, a young man who had back pain, and he was approximately 100 pounds overweight. I imagine that he feels all the time the way I feel when I'm carrying a canoe and a Duluth pack in the boundary waters. And I can only do that for about 100 yards before I have to set it all down and rest. He had a 64-ounce Big Gulp on the counter next to him, full of Mountain Dew. He said he drank 2 of those a day. I did the math. There's 750 calories in a Big Gulp. That's 1,500 calories a day. There's 3,500 calories in a pound. So I told him that if he just quit drinking Mountain Dew, he'd lose a pound every 3 or 4 days. He came back to see me 6 months later. He'd lost 50 pounds and his back pain was gone. Everyone knows that nicotine is bad for your heart and lungs, but it's not commonly known that it's also hard on your musculoskeletal system. Your bones, your joints, your ligaments and tendons, your discs, all of these things are adversely affected by nicotine. It doesn't matter whether you smoke, vape, or chew. However route you get the nicotine, it adversely affects all of this tissue. This happens because nicotine is a vasoconstrictor. It robs the tissue of its blood flow, so minor damage that occurs to us day in and day out can never repair itself. Osteoporosis is a disease that occurs when there's not enough calcium in the bones. Risk factors for osteoporosis include aging, cigarette smoking, excess alcohol intake, poor dietary calcium intake, and vitamin D deficiency. Calcium pills are poorly absorbed. They can cause kidney stones and hardening of the arteries. A simple way to get adequate calcium is just by drinking a glass of milk with every meal. Other foods that are high in calcium include dark green vegetables, nuts, and seafood. I like to think of calcium like a retirement account. If you put enough in before you retire, you'll have plenty left over for the rest of your life. As long as there is adequate calcium and vitamin D, bone remodels and gains strength when it is exercised. Cartilage gets its nutrition from joint fluid, and when the joint moves, that fluid is squeezed in and out of the cartilage, helping it to stay healthy and well-nourished. There are other benefits of exercise, including increasing blood flow, strengthening tendons and ligaments, and burning calories. When you exercise, you burn calories, but people who exercise regularly burn more calories when they are at rest. It's like a race car and an economy car sitting at a stoplight. Neither one of them is moving, but the race car is burning twice as much fuel as the economy car just sitting there. It doesn't have to be anything fancy. You don't have to get sweaty. Just start out by going for a 45-minute walk most days. It has to be fun, otherwise you won't do it. Once you're comfortable with that and enjoying that, if you want to add in some core strengthening exercises or even go to your local YMCA and work out on their weight machines, it's a great way to keep your bones strong and healthy.